Hi there, I'm Francis Jeanson with Datadex, and I'm here to tell you about an application we're building for peer-to-peer privacy-preserved linking. So as you know, there are a number of organizations funding studies that are seeking to bring data together from multiple studies to combine their data and really lead to a more big data analytics and machine learning. One of the particular applications in this data combination is around linking patient information from multiple studies. Patients sometimes have, are part of the study at a time point A, and then later on in time, we'll have more information collected about them in another study. And there's a big advantage if these studies can actually combine this data to have a better view of the participants and the patients in these studies. This can help them lead to precision health analytics. However, there are a number of challenges with this approach, and patient linking is not as easy as it sounds. First, to protect privacy, a lot of studies actually can't share PHI at all, and sometimes for good reason, because we want to protect privacy. Studies that do have some personal information, they might have things like health card numbers or first names, last names, or dates of births. They can attempt to link on this data, but only after they've encrypted the information. And because they do so, they need to rely on a trusted third party that holds a private key and who can do the linking without the individual studies being able to decrypt that information and find out who the participants are. That creates another challenge and bottleneck for some of these studies because they have to rely on this third party and trust them. And it takes quite a bit of time to set up these arrangements. Another challenge is how some of these tools currently being used are really deterministic in nature. And that means you can only link that patient information on specific identifiable data, things like the health card numbers or the first names, last names, and dates of births, but do not allow for the linking in a more probabilistic way with other fields that are part of the information, like other dates of visits, maybe the physicians that they've seen or sites that they've been at. Another challenge with linking is that the solutions often rely on being available from cloud providers and therefore storing the data in the cloud, which adds additional security and privacy risks. As an alternative, you might have a tool that you can install locally, but now you have your privacy and your security team that need to audit these applications, which can further delay your projects. So with Datadex, what we're working on is a linking app that lives in your browser, allows you to connect securely between peers to find either exact or probable patient matches. The way this works is from your browser, you load your CSV or data table and select the fields that you want to be able to link on. So in this case, we're showing ID or name as common fields that you might want to link. You then, in the browser, perform some cryptographic processes to obfuscate the fields that you want to link on. And in the browser, you can then audit and investigate whether this processing was done correctly. And none of this data is ever stored either on the cloud or on the local machine. After you've done this, you can then create a link that you can share with your peer, so with the other study coordinators, the other study investigators, so that they can then log on to the Datadex linking application, upload their own files and perform that cryptographic processing, and essentially then launch what we would call a linking job, where the data is being shared directly through a secure peer-to-peer connection between the two browsers. The data are partitioned so that the workload is shared between the computers. And then you come up with the results on the tables and the rows that match in a probabilistic way. So in the image here below, you see how row 1 from the local table matches with row 3 from the remote table with a probability of 100%. And for other rows, you may have a chance of matching that's lower than 100% because maybe only partial fields and partial sections of the fields will actually match. In the end, you can then share the remainder of the information that is not PHI, that's not personal health information, so that you can complement and have that full view of the participant. So this gives you a chance to combine the data and have information from multiple peers. So for example, here from peer 1, we get information for Susan Tao, such as her phone number. And from peer 2, we get the medication that maybe she was on in a separate study. And peer 3, we get more information about her demographics and income and scores. providing thus a full view of the patient with a chance to do much more precise health analytics. So as a result, this technology, we hope, will help you have more complete data with improved statistics, increasing your sample size, which leads to greater significance. You have greater, you have new entity features, which reveals new correlations and a greater chance to find new correlations. It's a peer-to-peer data exchange, helping with ensuring stronger security. And finally, it's browser-based, which means you have no installation required. So thank you very much. Here are some partners, part of our network supporting Datadex, and we'd be happy to have you contact us if you're interested. Thank you very much.